Are you struggling to place intravenous catheters on patients like this? Here is an alternative technique that could help visualize non-evident veins. Start by applying a blood pressure cuff proximally and a distal tourniquet below it. Set the blood pressure cuff to cycle every minute for at least 5 cycles. This promotes continuous blood flow and causes venous engorgement by creating congestion in the arm. The BP cuff squeezes blood into the arm while the tourniquet keeps the blood there. Blood gets in but not out. Look at the difference after 5 cycles. Veins are distended and easier to visualize. Arterial blood pressure exceeds the tourniquet, venous pressure is lower, so blood flows in but not out. Just got to be patient. Try this combined blood pressure cuff and distal tourniquet technique for your next difficult intravenous catheter placement.